Hi, everybody. This is going to be our digestive system lecture for part two. So last time we stopped talking about the acid reflux and heartburn, which was associated with the lower esophageal sphincter. We are going to continue now with looking at some of the common procedures that you may see in terms of um, the stomach surgeries associated with weight loss. So one is a gastric bypass. So as the name gastric implies, basically is associated with the stomach, and bypass means basically you are going over that. So if you take a look at the picture, before surgery, you will have your esophagus, you will have your stomach, and then that's connected to the duodenum, which is the first part of the small intestine. In the case of gastric bypass, you will have basically a majority of the stomach and sometimes the duodenum removed as a bypass, and you will only have a small gastric pouch rather than a full stomach, and that connects to the jejunum as it continues. So in this scenario, you will have basically very small space in terms of the storage of food. So the desire to basically eat a lot of food will decrease. Now, the stomach basically makes the stomach is smaller. So there's basically no space for the food to be stored. Um, However, it does have side effects in many cases, so people do have problems after doing the surgery. That includes problems with both digestion and absorption of nutrients. The other procedure that is less invasive compared to the gastric bypass is the lap band surgery. So in this scenario, they make a small incision and they add um, literally a silicone device that is around the top portion of the stomach. So if this is your whole stomach, they make this little pouch and they put a adjustable gastric band. So basically, this prevents you from eating and filling up the stomach, as your body thinks this is the size of the stomach. So the amount of food that can be consumed is significantly less. It is one of the most common options for treating obesity. And again, it's intended, as it says, for decreasing the food consumption. Interesting thing is that you can go back to the doctor and they can adjust this gastric band to make it tighter or looser for more comfort depending on the individual. One of the medical conditions associated with the stomach is referred to as gastric ulcers or stomach ulcers. A lot of people may have heard of this and they associate the gastric ulcers with stress. However, let me make that very clear. Stress does not cause stomach ulcers. The reason behind the ulcers is an actual bacterial infection, and this bacterial infection is caused by a bacteria called H. pylori. This bacteria has a drill head that literally drills through the mucus lining of the stomach. That is, this mucus lining is basically protecting the stomach from the hydrochloric acid or the acidic environment of the stomach. So when the bacteria is drilling a hole, it's basically exposing the underneath tissue to that acidic environment and make it more susceptible to damage. Now, here is basically a couple pictures. So these little holes that you see are literally the stomach ulcers. Since this is a bacterial infection, the best way to treat it would be a duration of antibiotics that would take care of it. However, in many cases, if you do have a stomach ulcers, they may come back later on. Now, moving on, after the stomach, your chyme is transferred to the first part of the small intestine, which is referred to as duodenum. This is a relatively short structure. If I ask you what is the main function of the small intestine, two functions should come to mind. First is chemical digestion. Again, anytime you hear the word chemical, automatically think about enzymes. And then after that, you want to absorb the nutrients after the chemical breakdown is done. Again, absorption was basically transferring things from the intestine or the digestive tract into your blood vessels or bloodstream. So, chemical digestion in the small intestine is highly dependent on pancreas, liver, and gallbladder. And as we go through the PowerPoint, it becomes clear why these three accessory organs are so important in terms of digestion. We also learned last time that the small intestine has three parts. The shortest of the three is duodenum, followed by jejunum, which is depicted in purple, and the last section or folding of the intestine is called the ileum. For the total of these three small intestine length adds up to about 20 feet long. Again, having this long small intestine is really important because it maximizes the two process of chemical digestion as well as absorption. So having this again is helping you increase the chance of absorption and chemical digestion. Now the second part of the, the first part of the small intestine, which is duodenum, is about 10 inches, which is relatively short compared to the 20-foot long intestines. The most important part or function of the duodenum are the following. It receives all of the digestive enzyme from its pancreas, and it's also receiving something we call bile, highlight this for yourself, from gallbladder and liver. Jejunum, which is the second part of the small intestine, is longer, definitely than duodenum, so it's about 8 feet, and it allows the same process to happen. So it still does chemical digestion and absorption, but please do note that it's not directly connected to the pancreas. So when we're talking about the connection of the small intestine to pancreas, liver, and gallbladder, all of these are through the duodenum and not through the jejunum or ileum. The last part of the small intestine is referred to as the ileum. Ileum is about 11.5 foot long, which is again making it the largest part of the small intestine. It is still going to be involved in chemical digestion and absorption. And as it finishes up, it connects to the cecum, which is the small pouch, and marks the beginning of the large intestine. So we keep talking about in terms of a small intestine and the involvement of pancreas, liver, and gallbladder. So let's take a look at these three accessory organs and their function within our body. So right here, and I'm kind of gonna show you this structure. What I'm showing you as dashed line right here, this is going to be your stomach. So hidden underneath the stomach, you have this kind of tadpole structure that is hidden underneath in yellow color, and this is going to be your pancreas. Pancreas is responsible for production of digestive enzymes. So basically, any digestive enzyme that's going to help you digest your carbs, digest your proteins, and digest your lipids or fats are going to be found inside the pancreas. Now notice there is this green line that runs through the length of the pancreas. This is called the pancreatic duct. So basically, all of the enzymes that are produced are connected and are emptied into the small intestine using the pancreatic duct. Now, pancreas also plays an extremely important role in terms of endocrine system. Endocrine system, if you guys remember, when we talked about it on the first day, is important in terms of releasing hormones, and it controls a lot of the activities in the body. Now, the two main hormones that are released in terms of your endocrine system from the pancreas are insulin and glucagon. So let's take a look at the insulin. I will come back to the digestive enzyme in just a second. So here is a scenario when you have ate the food. So food is going to go through your intestine, and that causes the sugar to basically broken down and eventually absorb into your bloodstream. So what you see as this circulation, this is depicting your basically your blood vessels. Now, the little blue circles that you see, that's the glucose. So notice that as the digestive system processes the glucose and your bloodstream absorbs it, there is a significant increase. There is an increase in the glucose in the bloodstream, correct? Now, as this extra glucose gains its access through the body and eventually to the pancreas notices what? The high levels of glucose. And therefore, what your pancreas does, it actually starts to release the insulin, which you see as these yellow dots. Now, insulin enters your bloodstream with glucose. And again, as the circulation continues to happen, the insulin and glucose, when they reach organs like your liver, which is depicted here, when they reach your skeletal muscle, or when they reach your adipose tissue, what the insulin in combination with glucose going to do is allow the glucose to be uptaken by your cells and converted to glycogen, which is a complex carbohydrate. So basically, instead of having glucose as these single molecules, when it is in the presence of insulin and enters into your cells, they form these long chains, and these long chains would be your glycogen, which is an easy way of storing glucose. So again, these single dots are my glucose. These chains are glycogen. And again, easier way to store it, harder to store. So notice by the time the blood leaves your liver or your skeletal muscle or your adipose tissue, the level of glucose is back to normal, and basically you are returning everything to homeostasis. Now, opposite of that is, and I'm gonna add this for you guys on a slide, opposite of that is the hormone glucagon. So glucagon is going to be released from the pancreas when your blood glucose, so when blood glucose is low. So let's say you've been fasting. The fasting causes a decrease in glucose. So what your pancreas does, so pancreas release glucagon. Now, glucagon targets your liver, and in the presence of liver, glycogen is converted to glucose. Now, glucose can go into bloodstream or into the blood vessel, and therefore increase in glucose. So this is basically glucose and glycogen work opposite of each other. If you have high glucose level, insulin kicks in and return glucose back to normal. If you have low glucose, glucagon is released and increases the glucose level. So remember glycogen I did in a previous slide, I did something similar to this. So this is my glycogen. Glycogen. When the hormone glucagon get a hold of it, it's breaking down the glycogen to individual glucose molecule. And that again, if the conversion is from glycogen to glucose, the hormone that is involved is hormone called glucagon. However, if we are changing glucose to glycogen, so going this way, the hormone involved is insulin. And both of these hormones are being released from your pancreas. Now, since we are talking about insulin, There are always the talk about diabetes, type 1 and type 2. Type 1 diabetes is known as juvenile diabetes. This is an autoimmune disease. Autoimmune disease. This is where your own immune system is attacking the cells in the pancreas that are producing insulin. This is not something to do with your diet. It has nothing to do with you having a sedentary lifestyle. This is basically your own body attacking itself. So these people are going to be insulin dependent for the rest of their life. You can't really do anything about this. Type 2, which is also known as adult onset diabetes, it's a result of bad eating, sedentary lifestyle, having high sugar in your diet, that causes basically your body to have continuously high insulin level. And eventually your cells that are receiving or interacting with insulin become insensitive to it. So continuously high level of insulin causes your cell to become insensitive to insulin. Now, in this case, many people become dependent or require to have insulin shots. However, in some cases, if they start to eat healthy and have more exercise in their daily lives, they may be able to cut insulin from their daily activities and basically just live a normal life. Type 1 diabetes, unfortunately, as I mentioned earlier, you will be insulin dependent for the rest of your life. So we have talked about the two main hormones associated with the pancreas, but let's go back and talk about the enzymatic activity of the insulin. So remember that pancreas is responsible for production of digestive enzymes. So digestive enzymes are the ones that are going to give you the ability to basically break down carbs, proteins, and lipids. So this should sound familiar to you. Amylase is a hormone that was previously mentioned to be produced by your saliva, and it was released into the mouth, and it's responsible for breaking carbs to simple sugar. We also have amylase inside the pancreas, which released into the duodenum. And again, it's still going to break down carbohydrates to simple sugar. Two new hormones for protein breakdown, trypsin and peptidase. Again, notice it's released from the pancreas. Look at all of these. And if they are if they're produced by the pancreas, they are going to be released into the duodenum. What is the goal of trypsin and peptidase? Breaking down protein to amino acid. In terms of protein, we also talk about another hormone called pepsin. If you guys remember, pepsin was produced by your stomach and was also released to the stomach and broke down proteins to amino acids. So be careful. If I ask you trypsin, trypsin is the pancreas. Pepsin is produced by the stomach. Lipase, again, produced by the pancreas, released into the duodenum. Its goal to break down your fat or lipids into the glycerol or fatty acid. This one I really didn't talk about, but if you recall from the first few lectures of the semester, we have the fourth group, which is basically DNA and RNA, which is identified as nucleic acid. You also have enzyme to break those down. It's called nuclease. It's still released from the pancreas into the duodenum and break down structures like DNA and RNA, which are nucleic acid, into individual nucleotides. Now, I'm going to repeat this, guys. Any enzyme that is produced by the pancreas is going to be released into the duodenum. We also talked about something called bile. Bile gets released from the liver and gallbladder, and it still gets dropped into the duodenum. So let's take a look at the liver. So here is the liver. It has two large lobes. So if this is my liver, you have this line that separates this called the falciform ligament. and you get the right lobe and you get the left lobe. Now, what are some of the functions of the liver in terms of digestive system? Is storage of vitamins that are considered to be fat soluble, and these are A, D, K, and E. Notice that the vitamin B and C are missing because those are water soluble. You also have production of bile, which I'll go to detail in just a minute. You also have something called detoxification of blood from the digestive system. So understand one thing, that whenever food or nutrients that's being digested is absorbed into your bloodstream, not everything that is absorbed is something your body needs or is something that is healthy for your body. So sometimes you absorb toxins like, let's say, drugs or medication or alcohol. Even though we consume them sometimes, for our body, they're identified as toxins. So before these things are allowed to be moving through the circulation and moving through the body, you really need to detoxify that blood. So blood that comes from the digestive system actually gets sent down to your liver. Liver cleans that blood, and then that blood comes out of the liver as a clean or detox blood. Another function that is not associated with liver in terms of digestive system is destruction of red blood cells. So red blood cells are destroyed by your spleen or your liver, or just white blood cells that are circulating in blood. So when the red blood cells are destroyed, if you guys recall, there was a component called heme inside your red blood cell. So red blood cell was made up of hemoglobin, which is shorthand to HB. Inside the hemoglobin, you had a component called heme. And when heme was destroyed, it produces a component called bilirubin. So bilirubin is the component that can be removed from the body by going to your liver, goes through your digestive system, and eventually gets removed as part of the feces. So keep that in mind. We're going to come back to it in a few minutes. So as of right now, we have learned that liver is playing a major role in digestive system in terms of absorption of vitamins, in terms of detoxification and production of bile. So let's stop this lecture now and we'll continue with the third part of digestive system, finishing up this lecture.